Hello and welcome back to Himalayan Network. This is me Pragati Singh and today we are here at Manokamna Hospital and we have with us Dr. Monika Agarwal. She is a gynecologist and obstetrician. She is also a gold medalist. So we will be getting to know about what are the common problems that a girl or a woman face from her for our audience. So ma'am, how often should a woman get a pelvic exam?
See, normally what we say in a female, whosoever is above 18 years of age, that female should get a pelvic examination done every 3 years. Basically, what we need is a pap smear of every sexually active female. So it's been seen that a female, if does a pap smear every 3 years, and if it is found to be normal, then it is sufficient till the age of 50 years. Minimum three pelvic examinations are must in a female's life, fertile life, before the age of 50. And in case if the female is suffering from any kind of problem, like there is any kind of white discharge, abnormal bleeding, intermenstrual bleeding, or postcoital bleeding, or any kind of purulent discharge, mixed discharge, foul smelling discharge, or any kind of pain in vagina or any kind of swelling, then she should immediately go to a gynecologist and get herself examined. Basically, what problem that we normally face during our day-to-day practice is that females are generally shy of getting examined, but that should not be the case. When you go to a gynecologist, please ask the doctor to examine you properly and let the doctor examine you properly. Otherwise, it's all futile to go to a doctor.
So one of the most common question, what is PCOD or PCOS and how can
Yeah,
we prevent it?
exactly. PCOD stands for polycystic ovarian disease, as we all can see. So I will break down the whole definition for you. Poly means many, cystic is stands for cyst, ovarian disease in the ovary. So polycystic ovarian disease stands for many cysts in the ovary. So first of all, we should know why there are so many cysts inside the ovaries. Basically, what happens in a female whosoever is suffering from PCOD, that female is not having regular ovulation. So the egg, which was supposed to grow up in the cycle, and then normally what happens when a female has her periods, a follicle starts growing. Then that follicle reaches its peak size during the mid cycle, say around 15th or 16th day of your periods. Then the follicle ruptures, and there is a small egg inside the follicle. That egg comes out. So that is the time when there is ovulation, and after 14 days of ovulation, there are periods or there is menstrual bleeding in any normal female. But in females in whom there is no regular ovulation, the follicle which starts growing, the growth of the follicle is halted at a certain stage, maybe at 10th day, maybe at 6th day. The follicle doesn't reach the optimum size so as to rupture and release the egg, and it converts into a cyst. So every cycle such cysts are formed, and ultimately there are so many small cysts in the ovaries that they further lead to defect in egg production. So in the PCOD, there is no regular ovulation. I'm not saying there is no ovulation at all. There is abrupt ovulation. In some cycle, suddenly there is ovulation which you can't predict. But normally there is no ovulation as of regularly.
So ma'am, how can one know or get to know that they have PCOD and when they can come to for the checkup?
Very good question. Basically, what I see these days, all the kids they are involved in binge eating, unhealthy food habits, and overweight. So most of the kids they prefer to take outside meals, momos, chow means, Maggi, YY, and they are afraid of eating healthy vegetables and healthy diet which is cooked at home. So overweight is the main reason for PCOD. Inactivity, lack of exercise. Most of the kids all the time they are busy in watching mobile. They are either on the couch or on the chair, either studying or watching mobile. So no outdoor activities, no exercise, no games. All these unhealthy habits, this unhealthy lifestyle is leading to more of PCOD. Basically, PCOD is to a certain extent it is genetic. A female who has PCOD is destined to have PCOD. It was decided right at the time she was born. Okay, so it's been generally seen that a female who is suffering from PCOD, her mother is also having the same problem. Her siblings are also having the same problem. Her sisters. So, but the thing, how can she can keep PCOD in check is by following a healthy lifestyle. which means keeping your weight under check and doing regular exercise and avoiding all kind of unhealthy foods.
So, what all nutrients can be added for a healthy menstrual cycle?
As I told you just now, healthy food habits. What are healthy food habits? Healthy food habits are avoiding all kind of binge eating, fast foods, and having a balanced diet. What is a balanced diet? In a plate, when you take your meal, there is 40% protein, there is 30% carb, there is 20% fats, there are 10% fiber, vitamins, minerals. So if your plate has all these items in balanced amount, then this diet is a balanced diet. In non-vegetarians, they can go for chicken, they can go for lean meat. What we ask to avoid is red meat, which is full of oil. What we ask to avoid is meat cooked in lots of oil and spices. You take 100-gram chicken daily, you get it grilled, and you eat it. This is very good for your health. But to accompany it with lots of oil and spices, that makes it unhealthy. Okay? In non-vegetarian, in vegetarian people, there are a lot of other sources of protein like paneer, like tofu, like all kinds of beans, like soya bean, and kidney beans, rajma, chana, chola, all kinds of pulses. They all are very rich in proteins. So have your diet like one full bowl of dal, one full bowl of curd, then a little bowl of rice, lots of green vegetables, plenty of salads, and a glass of water. This suffices your full meal.
So, ma'am, how can we know that it's time to check up for breast cancer? Or how can we examine first in us?
Actually, in breast cancer, see, breast cancer is one cancer which can be diagnosed very early if you are alert, if a female is alert. So, first of all, we should know ki who are more predisposed to have breast cancer. Breast cancer or most of the cancers are genetic. If any of your family member has your blood relation like your mother or your masi or your bua, anybody has breast cancer, then you can have. So get yourself screened at a very early stage. Second, do regular breast examination. How to do a breast examination? Whenever you have taken a bath or you are just standing in front of a mirror, so look at your both of your breast, look at them closely, like if there is a change in their shape, then in their change in their skin, the skin overlying the breast, in the nipples, then it should alarm you. Then next comes the breast examination. How to do a breast examination? Suppose this is the breast, you have to touch all the corners of the breast. You can do the breast examination either in this way or in this way or diagonally or circularly, in circular motion coming to the center. But the main concept of doing a breast examination is to cover all the corners of the breast and palpate with the pulp of your fingers and look for any kind of abnormal lump or swelling if you find any, or any, if you see that the skin of your breast is going inside, it's looking like a orange peel skin, dimpling of skin we call it as, or a nipple if it is going inside. All these are symptoms which can indicate towards a breast cancer. So self examination of breast every female should know, and she should do at least once a month. And if she finds any kind of small growth or lump in the breast, go to your doctor immediately.
So, ma'am, as we are seeing that a lot of hormonal imbalance in recent years. So, what is the cause of hormonal imbalance? And like we have seen, due to hormonal imbalance, girls and females are facing mood swings and all. So, how do you prevent?
Basically, these days, again and again, we are coming down to same point: unhealthy lifestyle, sedentary lifestyle, overweight, obesity and sedentary lifestyle. These are the two main reasons leading to all kinds of hormonal disturbances in the present era. In the previous era, when there were no mobiles, kids used to play, female used to walk. When there were not so many kinds of transport available, people used to walk a lot. So that used to suffice to their exercise part. But these days, we all resort to some mode of transport. We hardly ever walk. We are all involved in binge eating or unhealthy food habits. So that is leading to lots of hormonal disturbances these days.
So, ma'am, how to take care of vaginal hygiene?
Menstrual hygiene is one part that every female should know. During the menstruation, during the menstruation, or first we'll talk about vaginal hygiene. Normally, a female vagina is a self-cleaning structure, so you don't need to use any kind of soap. Nothing is required. You simply clean your vagina with plain lukewarm water twice daily. No soap, no betadine, nothing. Don't use any kind of perfume, any kind of powder in your vagina. Whenever you are menstruating, please make sure that you change your pads every 6 hours. Max to max, one pad has to be used for 6 hours. Then you have to discard it whether it is dirty or not. Never ever let the water when you are washing your stools that to come into your vagina. So whenever you wipe, it should be always from front to back. Wiping from back to front is the reason for recurrent urinary tract infections. So these are the ways a female can always take care of her vaginal hygiene. And last but not the least, don't try to shave your hairs. Vaginal hair. Vaginal hair are better cut. Okay.
So, ma'am, like if we want to visit a gynaec, should we save and come? Like females have this shame, like if we go pubic hairs.
No, 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 no. Yeah, you just trim your hair so as to like it sometimes it becomes very difficult for us to examine when there is this
Pubic hair.
pubic hair and that to unmaintained. And secondly, it leads to accumulation of lot of might be when you are menstruating, the blood gets collected and the clots can. So just to maintain your hygiene, it's better to keep the hair trimmed. And one thing I always want to tell you that among other cancers, the most common cancer in a female after breast cancer is cervical cancer. What is cervix? Cervix is the lowermost part of the uterus, which we can see in the vagina, which connects the uterus to vagina, is the lowermost part of uterus that we call as cervix. Cervical cancer is one cancer which is not at all genetic. It is acquired by your habits. Okay, so cervical cancer, the responsible virus for cervical cancer is human papilloma virus. How do a female gets infected with human papilloma virus? Mostly it is sexually transmitted. If it is not, generally it remains in your vagina. So normally any female is infected with HPV virus during some part of their lifetime. So normally what happens that the body overcomes this infection by its own immunity. It hardly happens that it causes some kind of difficulty or cancer. But we never know which there are some certain strains of virus which are very cancerous strains like 16, 18, 31, 33, against which the vaccine is available. What I want to talk about here is now about the cervical cancer vaccine. All the females who are below 14 years of age, your sisters, anybody in your family should go for cervical cancer vaccination. This vaccination is a miracle vaccine because it has reduced the incidence of cervical cancer worldwide. In some European countries, this is mandatory. This is in the government vaccination schedule. But the thing is that this vaccination is quite costly. That's why the government has not included here in this national immunization program. So those who can afford the vaccine, please do take it. This vaccine can be taken up to 26 years of age. Nowadays, there is a cheaper vaccine by our Serum Institute. So this vaccine has to be taken in 3 doses, 0 to 6, up from the age of 14 till 26. Up till the age of 14, just 2 doses are sufficient. So please do take the vaccine against the cervical cancer.
So, one more question, ma'am. Is it safe to use tampons and menstrual cups uh, in place of
Yes.
pads, sanitary
Actually,
pads?
the only catch with tampons is you should know how to insert. You should know when to throw. There is only one thing, some females just forget to take the tampon out. So then there is a thing called toxic shock syndrome, which can happen when when a tampon stays inside the vagina for too long. That tampon has to be taken out and thrown away after a certain period, maybe 4 to 6 hours or max to max 7 hours. But in case of menstrual cup, this is very safe, this is very eco-friendly, because these pads are making our whole environment dirty. They are mostly non-disposable. So it's very good to use a menstrual cup. The only catch with menstrual cup is you should know your size, you should know how to insert. There are so many videos available on YouTube. But if you can, please go for menstrual cup. Yes.
So, last question, ma'am. Any message you would like to give to the young girls or women?
Please don't indulge in unsafe sexual practice. These days, I'm seeing lots of young girls, maybe 15 years, 16 years, who are involved in active sexual life. But before indulging into such kind of habits, please do know about the safe sex. Okay. And secondly, get yourself vaccinated against cervical cancer. This vaccine is widely available. If you can afford to eat momos and to watch movies, get yourself vaccinated. Thirdly, maintain your vaginal hygiene. Fourth, eat healthy diet. Do regular exercise. Get some sun, ladies. We all
Vitamin D.
avoid sun.
Yes,
Vitamin
ma'am.
D is
It's very.
mandatory, and particularly the sun between 8 to 9 a.m. So all these things are necessary. And last but not the least, the ladies in the age group of 40 plus, get your pap smear done. Go visit a gynecologist. Regular gynecologist visit at least once or twice in your lifetime is mandatory. Some routine tests are mandatory. Don't neglect your health. Okay. And do your breast examination. Self examination is a big help in diagnosing the breast cancer in very early stage. Thank you.
Thank you so much, ma'am. You answered the question so beautifully, which will be very beneficial for our female audience. Thank you, ma'am.
Manokamna Hospital is a leading diabetes and multi-speciality health center. With state-of-the-art infrastructure, cutting-edge technology and full-time specialists, our system ensures the best outcomes for our patients. We are fully geared in terms of talent, technology, structure and spirit to redefine the concept of healthcare. With a 24/7 availability from medical emergencies to more than 15 different health departments, Manokamna Hospital is your way to a healthier and happier life.